Here's a shocking story from Texas. An Indian origin neurosurgeon, Dr. Rajesh Bindal, has been fined over $2 million for committing healthcare fraud. Imagine this: a doctor, somebody trusts with people's life, scamming the healthcare system. Now, let me break it down for you. Dr. Bindal, a 53-year-old neurosurgeon from Houston, has been accused of falsely billing Medicare and the Federal Employee Health Benefit Program for surgeries that he never performed. Instead of real surgeries, he taped small devices behind patients' ears, claiming that it was part of a complicated procedure. And here's the worst part: the device often fell off after just few days. Dr. Bindal runs the Texas Spine and Neurosurgery Center, and the investigators found that he billed for surgeries requiring operating rooms, even though no such procedure was done. In some cases, it wasn't even him performing these fake procedures. It was a sales rep or a physician assistant at his clinic. Now, can you believe that? Meanwhile, Dr. Bindal has been fined a staggering $20,95,000 plus. And according to officials, this isn't just about money. Fraud like this damages the trust of patients that have in healthcare system like Medicare. Now, did you know that Medicare fraud costs taxpayers over $60 billion every year in the US? And that's enough to fund more than 10 million hospital stays. Meanwhile, Special Agent Jason Meadows put it bluntly: the kind of fraud wastes taxpayers' dollars and deceives vulnerable patients. But let's talk about the human side of this. Patient trusted Dr. Bindal to help them with serious Medicare issues. Instead, he chose his personal greed above their trust. And here's a startling stats: neurosurgeons like Dr. Bindal are among the highest paid specialists in medicine, with average annual earning of over $6 lakh. Yet, that isn't enough for him. US attorney called it out, saying that Dr. Bindal knows the difference between the real surgery and sticking a device behind somebody's ears. It's not just unethical, but it's downright dangerous. Federal investigators worked tirelessly to expose this fraud. They found that these so-called surgeries were not just unnecessary but completely fake. And now the message is very clear: if you cheat the system, you will face the consequences. Now let's step back. Medicare is a critical program that provides healthcare to over 65 million Americans, mainly the seniors and people with disability. Fraud like this put additional strain on the already stretched system. And that's why cases like this are so important. So, what's the takeaway here? First of all, trust in healthcare providers is essential, but actions like Dr. Bindal's undermine that particular trust. It's a reminder that ethical practices matter, specifically in Medicare. What do you think should be done to stop Medicare fraud? Stricter regulation, harder penalties? Let us know in the comment section below. I'm Dhruti Athri, bringing you the latest story that matters the world.